So what we're going to do over the course of the next couple of packets is really talk about each vessel in the vasculature and really set it apart from the others. Okay, this is where we're going to see that theme of form follows function. Okay, this is probably the 500th time that you've heard that phrase, but we'll continue to see that here as well. The way the arteries look, the way the veins look, the capillaries dictate something unique about that function, about the function of that vessel. And so the important part here is to really set each vessel apart, look at what different structural properties it has, and how that lends to a different functional property, okay? So this one objective is probably going to cover the next 3 or 4 lecture packets. So let's look at the various vessels here for an overview. So we know we have arteries which carry blood away from the heart, veins which return blood to the heart. So arteries dump into what chambers? Or arteries leave what chambers? Sorry, arteries leave what chambers? Ventricles, and veins dump into atria, right? So arteries are always going away from the heart. They are usually carrying oxygenated blood, but we saw some examples where arteries are carrying deoxygenated blood, okay? We looked at the pulmonary vessel. There's also examples in the fetal circulation where the maternal blood or the fetal blood is deoxygenated and it's being carried in an artery. So it usually has oxygenated blood, but the more important criteria is that it is always going away from the heart. Veins are going to be always returning to the heart. And then in between, we have arterioles, we have capillaries, we have venules. And together, this is called the microcirculation. This is where we have the fine tuning, the regulation of flow. This is where we have the site of exchange of the capillaries. So this is really where all the magic happens, okay? Where we can tightly regulate blood pressure, where we can exchange oxygen for carbon dioxide and other metabolites, alrighty? And if you look over here on the right, we'll see that the arteries look very different from the veins. For one, they have a much bigger lumen, right? The veins have a much bigger lumen, and that's the diameter of the space for flow. And then the arteries have a much smaller lumen. We can also point out here that the arteries have the veins, have less smooth muscle in their wall, and the arteries have a much thicker lining of smooth muscle inside. Looking at capillaries. Right? What about this capillary dictates to us that there's going to be exchange here? What about the capillary? What is unique about the capillary that can tell us that some type of exchange is going to happen? Yep. Excellent. So it has a really thin permeable wall, which is a nice site for diffusion. Okay, remember that the movement of oxygen into tissues and carbon dioxide back into the blood happens via a passive process of diffusion. So we need a very thin membrane in the middle, and that we can see with the capillaries. Okay, so make sure as we go through each of these structures, you're really pointing out the unique differences in terms of structure. So the walls of vessels typically are all lined with endothelial cells. So all vessels are lined with endothelial cells. And then other components that we see in vessels are the smooth muscle, which is this layer of smooth muscle cells that forms a thick lining, specifically in arteries, and a thinner lining in our veins. And then we also see some connective tissue. We see fibrous connective tissue, usually composed of collagen. That's going to give us some tensile strength to the vessel. And then we see elastic connective tissue, usually composed of elastin. And that's going to give us some stretch or some givability or some malleability, okay? So we want our arteries, all of our vessels for that matter, to have tensile strength to resist the flow or the pressure, but to also have some bit of give. And we'll see that some of the vessels have more elasticity than others, but all vessels have these 3 properties. So there's smooth muscle, there's fibrous connective tissue, and there's elastic connective tissue. All right. So we'll start off by looking at the arteries specifically. Now, arteries, again, are larger in their diameter in terms of the thickness of the vessel, but remember, they have a smaller lumen, okay, the space for flow. They have little resistance, okay? Why do you think they have little resistance? Why is it important for our arteries to have little resistance? They are working against gravity in some cases, in some locations, but more importantly, something else, for them to have little resistance. What does resistance do? It slows flow, right? And we have a high pressure in our arterial system, and this is not the area that we want to slow flow, okay? So there's very little resistance in the arterial system, specifically in the arteries, the larger arteries, okay? We want to get that flow going. We have the high pressure coming from the heart, which is driving our circulatory system. Now, the walls typically have elastic and fibrous tissue, which we mentioned, and this is what sustains that high pressure of blood that's leaving the heart. Specifically for our muscular arteries, they're usually smaller in diameter, and they usually have a little bit less elastin. We'll talk more about why they have less elastin in a little bit. And then smooth muscle is a really important feature of our muscular arteries and arterioles. This is what, again, dictates the radius. The ability of smooth muscle here and its ability to be regulated is what can increase the radius. What did we call increasing the radius? Vasodilation, or decrease the radius, which is vasoconstriction. Okay, so I don't want you to confuse this. Most of our large arteries typically have elastin. Specifically, our muscular arteries have a little bit less elastin, and it's more important for them to have smooth muscle to sort of regulate that flow, right? Regulate that radius. Okay, now arteries are described as being a pressure reservoir in comparison to veins, which you'll hear me later on describe to be a volume reservoir, okay? So arteries are a pressure reservoir, and that means that arteries are able to hold on to or store that energy, that pressure, because of the nature of that thick, smooth muscle in the wall, okay? So they have that thick, elastic arterial wall, and it has a very low compliance. Does anyone know what compliance is? Does anyone know what compliance is? Sorry? Yep, it's malleability. So, or obedience is what I like to think of it as, right? How compliant is that vessel? Is it going to maintain its shape, or is it going to do what we ask? Is it going to give, okay? And so arteries have a low compliance. I like to compare them to being stubborn. They like to maintain their shape, okay? And so this is elasticity. And I want you to think about elasticity as the opposite of compliance. If something is elastic, it's going to really want to get back to its shape. It's going to be stubborn in that way. Think about a rubber band, right? If you stretch it open, it's going to really try to bounce back or snap back to its original shape, versus something that's compliant, okay? Think about a stretched out headband or a stretched out elastic. It's not going to want to get back to its shape very easily, and that's going to be high compliance. So lots of elasticity, little compliance, and lots of compliance, little elasticity, okay? That's a really important distinction to make. So arteries have that thicker wall, they have more elastin in their wall, they have more elasticity, and as such, they have a low compliance. Now we know that arteries are going to expand as blood enters during systole, right, that ejection phase or phase 3. And so when we have the semilunar valves open, blood is going to leave the ventricle, enter the arteries, right, in this case the aorta as an example. And when we are in diastole, when these valves close, we're going to have the recoil of that artery back to its original shape. So this is where the importance of the elasticity or the elastic nature of arteries comes in. That recoil is what maintains flow or maintains continuous circulation. Think about it. If this artery did not recoil as easily, then we would lose some of our flow during diastole when that valve closes. Okay, very, very important. So during systole, the valve opens. As volume leaves the chamber, we have stretching of that vessel. And so this is where that pressure reservoir comes in. As the vessel stretches, it sort of absorbs that pressure. But remember, it is very elastic, right? Very low in compliance. And as soon as the valves close, we're going to have that vessel snap back to its original shape, and that is what helps to maintain perfusion or maintain flow. Okay. All right. Now, compliance, we said, is a measure of how the pressure of the vessel changes with the volume. In arteries, we typically have low compliance. This means that they are stubborn. They like to maintain their shape. So a small increase in volume causes a large increase in pressure. Whereas in high compliance, which we'll see later on in veins, a large increase in volume is required to generate a large change in pressure. What that means is that arteries are the slightest change in volume that enters an artery, the large pressure difference we'll see. Whereas veins, in order to see a pressure difference, we're going to have a large, or we're going to require a larger volume entering that vessel. Okay. So for arteries, because they have a low compliance, we need a smaller change in volume to see a large change in pressure. And then veins are going to be a little bit different. We need a larger volume change to see a larger change in pressure. Okay. Right. So continuing to look at the aorta as an example, we know that the pressure in the aorta changes throughout the cardiac cycle. Does anyone remember the two pressures that we identify in the aorta? Oh, it's on the screen. So systolic blood pressure, right? Systolic blood pressure, that's the highest pressure we see, or the maximum pressure, and that is due to the forceful ejection of blood from the ventricle. Okay. Whereas diastolic blood pressure is going to be the lowest pressure we see, and that is after blood leaves the vessel and continues to move out into the peripheral circulation. Why does it never get to zero? Why does the pressure never get to zero, although the valve is closed? So the semilunar valves close, but the pressure in the aorta never gets to zero. Why is that? Recoil, perfect. So recoil. So we just described that. The recoil of this vessel, right? The low compliant nature of the vessel, the fact that it really wants to get back to its original shape, is going to propel the blood forward, and that maintains perfusion. So even in diastole, we never see the pressure get all the way to zero. It gets lower, but never all the way to